Hello and welcome to today's virtual Hinckley Forum. The Hinckley Institute of Politics is a nonpartisan institute at the University of Utah. The Hinckley provides an array of transformative experiences for students through internships, forums, and classes. Hinckley Forums seek to foster public discourse and civil debate on the most current and pressing issues, bringing in local, national, and international thought leaders. Today's forum is presented in partnership with the University of Utah Asia Center. The Asia Center at the University of Utah is a Title VI National Resource Center for Asian and Pacific Studies. The center serves as a hub for Asia-related activities at the University of Utah involving teaching, research, events such as today's lecture by Professor Ganguly, and outreach to K-12 schools and the broader community. The Asia Center supports Asian studies in its broadest sense, incorporating the languages and countries of the core regions of East, South, Southeast, and Central Asia, as well as Russia, the Pacific, and West Asia. We would like to thank our streaming sponsor, AARP Utah, for making our virtual forums this fall possible. And we would also like to thank our media sponsor, KCPW, for recording and rebroadcasting our forums as part of the Hinckley Radio Hour. If you have questions, please enter them into the YouTube chat. And with that, I will turn the time over to History Department Chair and Professor Benjamin Cohen to introduce our speaker.
Thank you. It's a great pleasure to welcome back to the University of Utah, albeit virtually, Professor Šumit Ganguly. Professor Ganguly joins us today from Indiana University, where he is the Rabindranath Tagore Chair in Indian Cultures and Civilizations, Professor of Political Science, and Distinguished Professor. If I were to read his CV, which is 32 pages long, we'd be here for over an hour. Such are his contributions to the Academy and to the greater public. I beg your forgiveness, Professor Ganguly, but I'm going to keep it much, much shorter. Before joining the faculty at Indiana, his academic career included stops at Hunter College in New York, as well as the University of Texas at Austin. He's also held administrative, research, teaching, and fellowship positions at, among many, Stanford, the Woodrow Wilson Center, Columbia University, the U.S. Army War College, Northwestern University, as well as positions in Hamburg, Paris, Singapore, and New Delhi. He's the author or editor of over 36 monographs and other writings, among the more recent, a work entitled The Possibilities and Limits of India's New Religious Soft Power. That's a policy brief from Georgetown University's Berkeley Center, published in July 2020. In addition to monographs, he's published dozens of articles, book chapters, review essays. For instance, in June of this year, a year marked by new and troubling tension between India and China, he authored an article entitled Recent Developments in Sino-Indian Relations, a review essay, and that was published by the journal The India Review. Professor Ganguly also serves as an invaluable voice in the public sphere through his writings in more popular outlets. For example, a piece published by foreignpolicy.com from September is titled India's Democracy is Under Threat. Today, his talk is Mangling at the COVID-19 Pandemic in India. Please join me in welcoming, with your mics now muted, Professor Šumit Ganguly.
Thanks very much, Ben. Only a good and dear friend would provide such a generous introduction. I'm most grateful for this opportunity. It's a pity I can't be in Salt Lake City in person, but this is clearly the next best thing, and it's a real opportunity to speak on a subject that I've been working on. And in fact, if I may engage in a bit of self-promotion, in the winter issue of the Washington Quarterly, there will be a version of this talk on which this talk is based, dealing with how India, in my judgment, has really mangled the COVID crisis. Just to set the stage, I'm going to provide a handful of statistics which are literally up to this morning. As of this morning, India had the second highest number of COVID cases in the world at 8.3 million. second only to the United States. There have been about 125,000 deaths. As of this morning, 124,685 to be precise. About 7.5 million people have recovered. India has a remarkably high recovery rate, about 92%, which is really quite striking, especially given the paucity of medical facilities in India, particularly once one leaves the urban areas. So I just wanted to provide those statistics as a kind of a baseline for us to talk for the talk. The talk is divided into three distinct segments. First, I'm going to talk about certain landmarks about how the COVID-19 crisis started and began to envelop India, the responses of the Indian state, about which I will have a number of critical things to say. And then finally, I will talk a little bit about where is India headed and what does the future look like for India and the like. To begin with, in terms of landmarks, my first theme, the first death in India was reported as early as March 12th. And on March 14th, to the credit of the government, India declared COVID-19 to be a formal national disaster. Now that is significant. It is significant because it then enables a government to invoke what's called the Epidemic Diseases Act, and yes, Ben will appreciate this, of 1897. That's still on the books. It's a colonial era act, but it's still invoked, and it's actually quite short. And the more recent Disaster Management Act of 2005. The former gives states across the country, as well as the national government, wide latitude to institute surveillance of communities and to regulate public behavior to limit the spread of the disease. And since it's a colonial era act, it has rather sweeping provisions about how you can be, quarantined without any recourse to the courts. Because colonial regimes believed in surveillance and control of native populations. And interestingly enough, India has still kept this on the books, and it proves to be quite handy when an epidemic strikes. On March 17th, following the third recorded death in the country, the government asked all states to promptly institute social distancing measures until March 31st. It also canceled non-essential leave for members of India's 1 million strong paramilitary forces. On April 6th, the formal death toll in India crossed 100. On April 20th, the Indian authorities allowed a partial opening of industries, including automobiles, textiles, defense, and electronics. However, industrialists remained acutely concerned about supply bottlenecks, limited availability of labor, and also the need to obtain appropriate clearances before they could open. Furthermore, the government decreed that if a single employee contracted the COVID-19 virus, the plant could be shut down for months. Okay, this is by way of sort of background and landmarks. Next, I'll turn to responses, which is really the heart of my talk. The responses to COVID-19 has varied considerably across India's 31 states, with certain states responding in an absolutely exemplary fashion and others being totally shambolic. Much of this has depended upon state capacity. India, like the United States, is a federal system, and consequently, the quality of governance across the country varies enormously. The quality of hospitals varies enormously. The number of doctors varies enormously, depending on what the state has historically done in terms of investing in a public health infrastructure. So they ran the gamut from the western state of Maharashtra, which is home to the megacity of Bombay, to the state of Rajasthan in Western India, to the state of Tamil Nadu in the south, to the state of eastern state of Orissa. These states initially had fairly good responses. Now, the best response, to no particular surprise, came from Kerala, which has long had a good public health infrastructure because it's been run by a communist government, which, while it has not promoted economic development, has certainly provided a threshold of social welfare that is comparable to that of Costa Rica. And so Kerala actually, which sadly now is facing a second surge, initially did remarkably well in terms of coping with the crisis. The states that I mentioned had done well initially have now, to varying degrees, sort of slipped on that scale. My home state of West Bengal got off to a solid start, but unfortunately, two things intervened. Number one, the economic crisis became so acute that by midsummer, the government was forced to relax some of the regulations that it had instituted because the economy was simply cratering. And the question was, in a relatively poor state, what do you do in terms of providing sort of basic employment to people who live on the edge of poverty and trying to protect their lives? And ultimately, some of the restrictions were lifted. Almost invariably, there was a surge. In addition to that, because state level elections are coming up next year, and Bengal has a substantial Muslim population, Chief Minister Mamata Banerjee decided to allow a certain number of Muslim religious gatherings, largely with an eye firmly cocked on the Muslim vote. Again, the consequences were almost inevitable. Okay, I've given you some sense of the range of responses of states to the virus. Let me turn to the central government, the national governments. In India, it's referred to as the central government, the national government's response. It was extremely uneven and arguably draconian. Faced with the possibility of widespread community dispersion, it imposed a nationwide 21-day lockdown on March 24th. This left close to 100 million migrant workers who live a hand-to-mouth existence in the country in the lurch, because all public transportation was also brought to a complete halt with 4 hours notice. So imagine the plight of these people in 100-degree Fahrenheit heat, having to trek sometimes, and this is not an apocryphal story, sometimes trekking 100 to 200 miles home on asphalt roads with absolutely no assistance from the government, relying on the kindness of strangers. And sometimes that kindness was not visible or forthcoming. And on top of that, the police, sometimes in certain states, attacking them for being out in the streets. I mean, imagine the colossal cruelty imposed on a hapless population. Subsequently, on April 14th, it was extended to March 3rd, the lockdown. One of the most compelling reasons for the lockdown, apart from India's population density, which averages about 450 people per square kilometer, is that between 85 to 95% of the population uses its extensive railway network in highly overcrowded trains. Ben has had some experience thereof, as have I, and he knows what I mean by overcrowding. It's sort of like the Tokyo subway at rush hour, to give you some idea of the level of overcrowding, and you can imagine what kind of spread would have ensued. So my quarrel is not with the lockdown, but in the manner in which it was carried out without any kind of preparation, without any attempt to alleviate the plight of the most desperate in India. India's other efforts at the national level to alleviate the plight of the poor, in my judgment, has been anemic. It has allocated about $23 billion, less than 1% of its GDP in public spending to assist the poor. It also promised to provide 5 kilograms of rice or wheat and 1 kilogram of legumes for about 3 months to about 2/3 of the population. However, since the target was based on the 2011 census, activists claim that close to 100 million people will be excluded from the scheme. And of course, virtually none of this assistance reached the migrant workers as they were stranded far from their homes. Worse still, in one survey conducted by an NGO, the Stranded Workers Action Network showed that 96% of the migrant workers did not receive rations, and 90% of them were not paid by their employers. This is truly appalling in a democratic country. Subsequently, on May 13th, the government announced a more substantial $266 billion package. Now, on the face of it, that sounds great, doesn't it? Most of these funds, however, were already in the spending pipeline. Nevertheless, this package alleviated small businesses through loans to state-owned power generation companies, which were suffering because much less power was being drawn with the industrial grid at a standstill, and substantial insurance cover for health. More importantly, the government promised another 5 kilograms of wheat or rice per person in April, May, and June for 800 million people. And there were a few other SOPs that were included. Apart from these governmental efforts, I should mention that a range of non-governmental organizations have entered the fray. Anecdotal evidence suggests that they are making a meaningful difference in various parts of the country. Unfortunately, I do not have access to systematic survey data as yet, and so I can't really comment on the efficacy of these efforts, but the anecdotal evidence suggests, newspaper reports suggest that they have alleviated the plight of some of the most desperate in India. Obviously, one question we need to look into is testing. The initial efforts were fairly weak. They were fairly poor. For example, as of mid-May, India was carrying out 1,540 tests per million. To give you a sense of how that stands, comparable figures were for the United States, and many of us have been highly critical of efforts here, but comparable figures were 31,000 for the US, in Spain, 52,000, in Russia, 42,000, in the UK, 32,000, in Italy, 45,000. Now, in fairness, the bulk of the statistics that I have cited and which were relatively easily accessible are from advanced industrial states. So we might cut India some slack. But on the other hand, 1,500 tests a day is really bad. Admittedly, in fairness, that has changed dramatically. And today, India is carrying out 1.5 million tests a day. I don't know the figures per million, but obviously the testing regime has changed quite dramatically. According to Indian virologists, the low levels of testing in the initial days was largely a function of the lack of capacity. India just did not have the labs available. Subsequent to those initial figures that I have quoted, what has happened is India has now come up with an antigen test, which produces results fairly quickly. Unfortunately, the problem with the antigen test is the results are accurate in a band between 50% to 84%. So the other test, which takes about 48 hours, but is much more accurate with almost over 90% levels of accuracy. But a cheap test this cheap antigen test has come about. So India is able to test much more vigorously, even though, it's the accuracy leaves something to be desired. One interesting tidbit is that people have argued, and even some medical professionals have argued, that India's infection rate, given the density of its population, its positivity rate, is not that dreadful. And in part, that might be explained by the fact that so many pathogens exist in India. And Indians become exposed to pathogens at a fairly early age. And consequently, they build up natural immunity. That's one plausible explanation. The other is that in huge numbers of rural areas, a lot of people might be falling sick, but we don't really know if they have COVID because the testing regime has not completely reached them. So one has to be somewhat skeptical about those figures. Let me turn now to a bit about India's health infrastructure, which I have alluded to earlier in my talk. And this is a set of deeply disturbing figures. And it gives you an idea of the problems that India is currently encountering and will in the future. India spends a mere 1.29% of its GDP on health. Comparable figures are 9.2 for Brazil, 8.1 for South Africa, 5.3 for Russia, and 5% for the People's Republic of China. So the weakness of the health infrastructure in part also explains why the disease could spread so rapidly, apart from issues of India's population density and the inaccessibility to healthcare in much of India's rural areas. On a slightly more positive note, India does have a vast pharmaceutical industry. Many of the drugs that we get at our local CVS or Walmart are, or any other major pharmacy, Walgreens, are actually manufactured in India, especially routine drugs. And in the event that a particular cocktail of drugs can either alleviate or contain the symptoms of COVID-19, India should be able to mobilize its resources to rapidly produce vast quantities of antiviral drugs. And to some degree, it's already doing that. And it should be mentioned that India's National Institute of Virology is already collaborating with major American and European partners to develop a vaccine. Simultaneously, the Serum Institute of India, which is a private company located in the city of Pune, already has a link with AstraZeneca and is poised to produce like 200 million vaccines within a month. And they have taken a massive gamble in terms of producing vials, in terms of having hypodermic needles ready. They have invested millions of dollars in anticipation that the AstraZeneca vaccine will work, and they will be in a position to essentially flood the market. But it's one hell of a gamble. It assumes that your partner will be able to produce a viable drug, and there have been a couple of hiccups with AstraZeneca so far, with at least a couple of patients falling ill. It's unclear if it was a result of the vaccine or some underlying condition, but AstraZeneca did pause its trials at least a couple of times before resuming them, and they have not been allowed to resume in the United States because the FDA still is acting out of an abundance of caution. Let me now turn to conclusions. Whether India will be able to still avert a health apocalypse before a vaccine becomes available, especially as we move into the winter months in northern India. In southern India, it doesn't matter because the climate is pretty much, the weather is pretty much the same. It's unbearably hot in most of the year. It might be slightly marginally cooler, but no one wears a sweater or a jacket in southern India, unless you're at a hill station. So it's really in northern India that will matter, where there's a lot of poor people and who huddle in fairly close, cramped conditions in winter, often burning wood fires, even in their homes, to remain warm. It's not clear what's going to happen in the absence of a vaccine and the inability to socially distance. The interesting thing here is that in the past, despite the obvious limitations of its health infrastructure, India has managed to contain and suppress a range of epidemics. However, given the sheer contagiousness and virulence of this particular pathogen, the density of India's population, and hence the ease of transmission, coupled with its limited health infrastructure, its past successes may not be a reliable guide to the future. Already, the IMF has estimated that India's economic growth will plummet. According to a survey conducted by the Stranded Workers Action Network, which I had alluded to, a mere 0.6% of India's 400 million migrant workers have found shelter in government relief shelters, and 2.2 million have received food. Consequently, their distress, unless the government dramatically changes its course, which I see as unlikely because Prime Minister Modi has basically retreated in the face of this virus and has left India's poor largely to fend for themselves. So the next few months will bear watching, particularly as the winter descends, and thereafter in January and February, we will have to see if a vaccine, a safe and efficacious vaccine is on the market. If it is, there is considerable hope, because there's a curious phenomenon in India, in India's political culture. The governments in India are terrible in terms of dealing with routine tasks. But governments in India, including the present one, have a peculiar ability to tackle crises. Even though they have mangled the crisis thus far, it seems that they are gearing up very well to work with the National Institute of Virology and the Serum Institute of India to distribute vaccines on a nationwide basis, and are already involved in conducting surveys of medical personnel and medical workers, including janitors who work in major hospitals, to ensure how many doses would be needed for these, what we refer to in this country as first responders. Those are the people whom the government is targeting first, followed by people with comorbidities, followed by people who are of a certain age, like 60 or older. as a consequence, despite its present mangling of the crisis, I will end on a slightly hopeful note that it will be able to at least distribute the vaccines in an efficacious and efficient fashion once it is widely available in India. Let me stop over there, and I'll be happy to take questions or address any comments that people have.
Thank you, Professor. That was so detailed. That was a wonderful, wonderful lecture that you have for us. We do have a couple of questions,
Yes.
so I'll go ahead and ask those now. They're really interesting. Let me ask the first one. What impact has COVID-19 had on India's pre-existing political unrest and income inequality?
Of course, in terms of income inequality, it has disproportionately fallen on the backs of the poor. For India's middle class or wealthy, it really has been more of an inconvenience and a fear that they could get infected. But for the poor, who are largely dependent on the Dickensian conditions that prevail in India's public hospitals, it has fallen disproportionately on their backs. There was a second component to the question.
Yeah, so has this added to political unrest?
It has not really significantly contributed to political unrest as yet.
So not like what we're seeing here in the US.
No.
Okay. Yeah. Okay, so our next question is, India is under a Hindu nationalist central government. Is there anything about the response that reflects this religious and political perspective?
No, it's just a basic incompetence. It's incompetence and uncaring and callousness and Modi's decision-making style. Prime Minister Modi earlier rolled out last year a goods and services tax, but it was completely half-baked with terrible consequences for small businesses and with bizarre regulations, which many small businesses couldn't comprehend. And so that was one. Earlier, he had demonetized close to 80% of India's large currency notes with overnight, with no warning at all, literally overnight, with disastrous consequences for people who were stuck with these large currency notes and had to go and wait for hours in a bank, and banks were completely overwhelmed with the sheer number of people trying to exchange money. So that's typical. The decision, for example, to abruptly instill this lockdown with 4 hours notice and shutting off all transportation is in keeping with his earlier decisions. Very abrupt, something pops into his head without proper consultation, without suitable preparation, he goes ahead and makes the decision. So there's an element of callousness and thoughtlessness in his decision making, and this was characteristic, but can't be attributed to his ideology.
Yeah. I think that leads great into our next question is, do you see changes in government leadership bound to happen as people have seen how the government has responded to COVID-19?
That's a fascinating question. Fortunately for Modi, he still has close to 3 years in office, and memories fade. People move on to the next issue. If in the next 3 years he manages to boost economic growth, if he manages to generate employment, if he boosts India's infrastructure, suddenly COVID will be a fading memory. On the other hand, if he fails in these tasks and Hindu-Muslim violence continues to rack the land, if unemployment remains high, if infrastructural developments don't take place, if economic growth continues to be anemic, and you have domestic violence, you could see a potential change of government. Modi has also been blessed by the fact that you have the most weak, disorganized, dispirited, and leaderless opposition. And thereby, Modi has been able to dominate the airwaves for the most part because the opposition is so utterly inept.
That's interesting. And you also mentioned that states have such vastly different responses to COVID-19. Do you think there will be changes within the states, maybe a little bit more, depending on how well they responded?
Of course, yes, I think
Yeah.
that will definitely play a role in terms of how things play out, because the state elections are staggered. They don't move in lockstep with the national elections. So a number of states like West Bengal has an election coming up next year. So, state leaders may face the wrath of their local populations much earlier before Modi has to face the music.
Yeah. How often does India nationally have a
Every 5
re-election?
years.
Every 5 years.
Yeah,
Okay.
and so the
Interesting.
next election will be 2024.
So he has a little bit of time to
Yes,
show that.
alas,
Yeah.
alas, yes.
Which is not what's happening here for Trump. So we'll see what happens.
Yep.
The election's happening right now. Okay, so I have another question here. I'm just gonna say what they said. It says, I'm curious about the experiences of overseas migrants who have returned to India from several countries experiencing significant outbreaks. And how can we compare the experiences of internal migrants in India during the emergency response as compared to limitations on migrant movement in places like Singapore?
This is quite fascinating. Of course, the expatriate Indian workers who are professionals just stayed put. Whether they're in Singapore, they're in Abu Dhabi, if you're an engineer, you're an accountant, you are a journalist, you stay put and hope that you won't get laid off. So those folks I don't really worry about. But it's the ones who are poorer, who do menial work or semi-skilled labor like carpenters or mechanics. The government actually did a fairly good job of flying them back to India. Now, they're still facing hardship because they had relatively well-paying jobs in, say, in the Middle East or in Singapore or other parts of Southeast Asia. They are obviously hurting because of unemployment, but they managed to make it safely home because the government ran a series of flights. The interesting thing is, though, that they were either flown back free or with highly subsidized flights. And this caused considerable resentment in India with internal migrants, workers who were left to the vagaries of the weather and their own meager resources. So there was a clear difference in terms of how internal migrants were treated and migrant workers stranded elsewhere in the world.
You brought up a lot of interesting points. It made me think of the fact that, here in the US, we have, the saying that, money talks in our elections and in our government as well. With the people who are not doing so well, especially in the context of COVID-19, will they have enough power to change government in the context of here in the US, money speaks. Does money speak in India as well? Or do the people who have less money, do they have as much of a voice? I guess is my question.
I'm going to give you a kind of a strange answer. I'll say yes and no. Indian elections have become phenomenally expensive, particularly with the growth of television and with social media. And the last election, unfortunately, I don't have the figures at my fingertips, was easily the most expensive election in India's history. And a huge amount of corporate money went into the coffers, particularly of the BJP. But that said, the one thing that does work in India is adult franchise. That India doesn't have an electoral college. It's literally one person, one vote. And the Indian electorate has become incredibly sophisticated. In large part, Modi won because in his first term, he had actually delivered in terms of a range of social welfare programs. He had curtailed his animosity towards Muslims for the most part. And he had come across as someone who could govern. It's in his second term, things seem to be really unraveling, particularly as he starts playing the Muslim card, the anti-Muslim card. So elections are incredibly important, and especially for India's poor, who have very little else, but they have the power of the ballot. And they are the ones that go out in droves and vote. It's not the sort of the comfortable middle class. And number of surveys have demonstrated that the middle class is very complacent. Whereas the poor go out and vote in droves.
That's amazing.
We need to learn that here. They possess.
Yeah. How you brought up something interesting about Muslim communities. What is the percentage of Muslims in India? I know it's
about 14% of the population, okay. So about 140 million people.
Okay, that's good to know.
Making India the second largest Muslim country in the world.
Yeah, wow. What is the first?
Indonesia.
Indonesia. Okay, we have a lot of audience questions. I'll go to the next one. How has COVID impacted India's relations with its neighboring countries, particularly Pakistan?
Right. Modi made available about $100 odd million. No, less. Sorry, much less. About $10 million in assistance to the neighboring countries, this was also made available to Pakistan. To some of the smaller countries in the region, India has actually sent out small medical teams to provide assistance.
So, okay. Our next question is, has India kept up with increased demand for PPE, so personal protective equipment, for essential workers and general population, while the US has not? Has it experienced an economic boost in this and related industries as a result of the global pandemic?
Yes, that industry has seen a dramatic boost. I was just reading about it a few weeks ago in one of India's principal financial newspapers, The Economic Times, about how the PPP industry is thriving. For example, in this country, the hand sanitizer industry, the mask industry is booming. Initially, there were serious shortages of PPE, but I have not read of any shortages at the present time.
Yeah, I remember you talked about vaccines and medicine are largely, produced in India. So I imagine that those as well have gone up.
Yeah, they've gone up. And also certain textile manufacturers very smartly switch production to PPE.
Yeah, we don't need other things, but we need that PPE. Yeah. Okay, so I have a question. This is sort of like a general question that can lead into another one. What does the healthcare system look like? Because you mentioned that they spend so little per person on healthcare. What does the healthcare system look like, especially in comparison to here in the US?
It all depends. Okay. If you are an American and you want a knee replacement surgery, and your local orthopedic surgeon says, well, without insurance, that's going to cost you $15,000. You decide to buy a plane ticket to India in business class, which is about $6,000, probably less now with COVID, probably even half that with COVID. You fly to India, you get the knee surgery done for $2,000 in an absolutely spanking clean facility by a doctor where she obtained her medical degree from Johns Hopkins, and then trained at Mount Sinai. So if you have $2,000 to spare, you can get the best healthcare in the world in India. On the other hand, if $2,000 is what you make in a year, as many Indians do, you'll be lucky if in 6 months you can get a slot in a government hospital, and then you may die, or your knee might have to be amputated because you ended up with opportunistic infections. So you have these two extremes. I've fallen ill in India and have gotten healthcare for just a pittance of my American standards, and gotten fabulous healthcare, and have never fretted that the doctor didn't know what she was doing or what he was doing. Not for a moment.
But it just, I mean, it depends on how much money you have for access.
Yes.
Okay, so I mean, that leads into this next question is, if a vaccine were to be made, what would the dispersion of that look like, especially in rural areas where I imagine, you know, people are living, like you said, on $2,000 a year? Would they be able to get vaccines if they were even there to arrive for them?
The current government is saying that they will make the initial surge of vaccines free. If this requires annual vaccination, then people will be expected to pay. And I suppose at a government hospital or a government healthcare facility, a basic healthcare facility in the rural areas, there will be some nominal charge, probably at cost. But the initial, the first tranche of vaccines will be free, according to the government. And in fact, some people complained to the Election Commission of India that the government was using this as an electoral ploy in certain states where it's coming up for re-election. And the Election Commission ruled no, that this is not an electoral ploy. This is a legitimate government function.
Well, that's the last question we have. Thank you for all of that, your passion and for all of your expertise that you brought to this subject. I certainly learned so much, so I really, really appreciate it. And to everyone watching, we thank you for tuning in, and we hope that you'll join us at the next Hinckley Forum. Thank you, Professor, so much for joining us.
I'm delighted to do this, and I apologize again for the little technical glitch at the beginning.
No, you're totally fine. We made it. We're here, so we're good.
And I'm grateful to Ben and everyone else and Molly for their kind assistance and inviting me in the first place.